Let's bring in ABC10 medical expert, Dr. Payal Kohli. We have a lot of questions. Doctor, thank you for joining us here at the last minute. So 6 cases so far with the Johnson & Johnson, all women. Why women?
So, Walt, it seems to be something related to the immune activation. So we're not entirely clear why this is, but this is something similar to what we saw with the AstraZeneca vaccine in Europe. And so something about the immune system of young women when they receive this type of vaccination, which remember is an adenovirus vaccine, not a messenger RNA vaccine like the Moderna and the Pfizer, seems to somehow activate their immune system to make antibodies against the platelets, which are the clotting cells in our body, causing those platelets to stick together and form clots and using up those platelets, causing their numbers to go down. So, just like with AstraZeneca, it was women under the age of 50 that appeared to be the most effective. Perhaps there's hormonal influences. We don't quite yet know why, but it does appear to be a pattern.
So on a scale of 1 to 10, I mean, obviously 6 cases, and the CDC is pressing pause. How concerned are you? And first of all, do you support that?
Oh, I 100% support that, because I think one thing that's been really admirable here is the CDC has been very proactive about being really aggressive, looking for complications. Now, this signal did not emerge in the clinical trials because we didn't have millions of people in the clinical trials. And we're seeing 1 out of every million or so person have this type of reaction, which is actually lower than the background rate of this type of condition happening just naturally, in response to something else. So I do think it's very rare, but on a scale of 1 to 10, I would say I'm probably about a 6 or a 7, in the sense that I do want to make sure that we figure out who is most susceptible. It appears to be younger women before we continue to put this vaccine into people's arms. But I will say that overall, the benefit of this vaccine obviously substantially outweighs the risk, which is this very rare side effect, which is occurring at less than a background rate.
So let's say, for example, the CDC and the FDA say, okay, we're going to go forward with this. Now, if you're a woman between 18 and 49, how confident would you be in going and getting the Johnson & Johnson? Would they have to determine that these 6 women had some type of a pre-existing and that led to the blood clotting?
Yeah, not necessarily. Obviously, there's genetic factors that predispose certain individuals. But I think if I had to predict, I would say the CDC is likely going to say something like, let's use this in older individuals rather than younger ones, just like the European Medicines Agency, which is the FDA equivalent in Europe, did for the AstraZeneca vaccine. And if I was a young woman, under the age of 50, I probably would not get the Johnson & Johnson vaccine. I would try to get a Moderna or Pfizer vaccine because those are readily available and they have not been linked to this complication.
Okay, thank you, Dr. Kohli. We got some viewer questions coming in right here now. What does it mean for people who got it last week in Sacramento County? What should they be on the lookout for symptoms-wise?
So symptoms-wise, I think you mentioned a few, but I'll go over them again. You want to make sure you don't have a severe headache, because we know that this complication can cause blood clots to occur in the sinus and the brain. You want to make sure you're not short of breath, because you can get blood clots occurring in other parts of the body, like the lungs. You want to make sure you have no leg swelling or leg pain, no abdominal pain, no visual changes. Really anything that seems out of the ordinary. I would have a low threshold if I was somebody who got the Johnson & Johnson vaccine to check in with your physician, particularly in that 1 to 3 weeks after. Now, if you've crossed the 3-week mark, you can rest assured, because most of these reactions occurred in the first 3 weeks. But again, continue to have your radar up a little bit as we investigate what's going on here.
Yeah, I think the radar is definitely up for a lot of people. Shauna, thank you for sending that question in real time here with Dr. Kohli. We appreciate that. All right, Doctor, we thank you for your time this morning as we all try to work through this. Again, this all came down at a little bit after 4 o'clock this morning, our time.